It's a state in which you have excess production of thyroid hormone from the thyroid gland beyond which the body requires. Why is it a problem? Does it have any effects on the body? It's an autoimmune disorder called Graves' disease. Say a nodular goiter and one of them becomes overactive, and that's what we call a toxic adenoma. Or if it is a big goiter, then we call it a toxic multinodular goiter. Or sometimes it can occur as a result of treating hypothyroidism without monitoring, and you end up getting hyperthyroidism. They tend to have tremors, are quite anxious, and they sweat quite a bit. And it's very difficult for them to either fall asleep or stay asleep, so they tend to present with its insomnia. You end up having persistent fatigue with muscle weakness and even increased bowel movements. They can go up to 5 to 6 times in a day for a long call. And for women, you find it also affects the fertility such that their periods tend to be lighter or even end up without periods, which is called amenorrhea. You would want to do a blood test, which is called the thyroid function test, antibody tests like your imaging, like a thyroid ultrasound, if radioactive iodine uptake scan. And one of the common drugs that you have had, drugs called carbimazole, which tend to prevent the hormone from being produced. If you are a pregnant woman, it can only be used in the first and the last trimester. An alternative to this would be another drug called propylthiouracil. Then treatment would be for about a year to a year and a half, maximum 2 years. Perhaps going in for surgery or doing a radioactive iodine ablation. Surgery is indicated perhaps for people who have also protruding eyes, because if you try to destroy the gland using radioactive dye which contains iodine, it can worsen the eye symptoms. But as you give the carbimazole, we also give what are called beta blockers. That's just to try and control the heart rate. And so that's why it's important to understand the cause for you to understand, can this hyperthyroidism go away? A small proportion of patients, up to 2% of pregnant women who may get what is called postpartum thyroiditis, where you get acute inflammation 6 weeks after they have delivered, you find that it actually goes away, or if it was induced by an infection, and that's what we call subacute thyroiditis, and those ones are short term. But definitive, if it is Graves' disease, after a trial of treatment for up to 1.5 years to 2 years, you may consider surgery or radioactive iodine, but that one is in consultation with the endocrinologist. Now, why do we talk about hyperthyroidism? Because it also has a great impact on women's health, because it's been associated with frequent miscarriages, or women get pregnant but have preterm births, or babies who are born with intrauterine growth restriction, or some degree of mental retardation. And that's why we tell a woman, before you get pregnant or plan to, ensure we've tried to control the thyroid. In the event that you do get pregnant, then we would switch you to propylthiouracil to try and manage during the pregnancy. It's tricky for some, especially the elderly, to differentiate it from menopause, and that's why the lab test would be very important. For women, the other issue is the fact that it would give you irregular cycles. So if you are having primary or secondary infertility, then one of the tests we tell you to do is a thyroid function test, because it plays a very critical role. And one of the very important things you need to understand is there are some people who have started off as having hyperthyroidism, then transition to hypo. And it's very commonly in people, one, who had radioactive iodine ablation, or they had surgery and they completely remove the gland, and because it is still useful, they end up getting the hypothyroidism. But in some cases, you started off with the inflammation of the thyroid gland, it stabilized, you became euthyroid or normal, then later on it went to hypothyroidism. So it's something to think about. And finally, one of the questions we commonly get asked is, there's some people who believe that they've been cursed when they are told they have thyroid disease, but that is just really a myth. And one important thing is also to look back in the history. There are probably some relatives who did have similar symptoms, who could present with acute psychosis but were labeled as having psychosis, yet it could have been just hyperthyroidism. And then when it comes to attempting traditional treatment or herbal treatment, there is none per se that have actually been found to be useful. But what we find is, for patients with hyperthyroidism, we tell them that you avoid foods that are high in iodine, iodine like the seafood when the disease is active, because excess iodine is going to make more thyroid hormone and worsen the condition. But certain medication, like some herbs which contain the ingredient for thyroid hormone like ashwagandha or bugleweed, have actually been found to be quite useful. One very key thing when it comes to hyperthyroidism is it's very easily triggered by stress. So one of the things I always implore is, if I find I'm not able to get through to the patient or they're not willing to receive counseling, is you try and teach them other non-pharmacological methods to try and reduce their stress, like yoga and meditation. And finally, just a small footnote on the impact of libido. It's interesting that when you have hyperthyroidism, some say they actually have increased libido, but long term you find that it's actually diminished, as opposed to in hypothyroidism, because of the persistent fatigue, the weight gain, the depression, they're not really interested in having any relations with their partner, and so they tend to report a low libido. But this tends to improve as you control the thyroid hormone.